Hello everybody, and good evening, and welcome to another episode of Sorgen Wellness Strides. At Sorgen, we do compression socks and stockings, and a lot of marathon runners are our customers. And while interacting with them, we realized that a lot of marathon runners do have some issues and concerns with the back, knee, ankle, foot, etc. And being a very responsible healthcare company, we thought that why not, we bring experts from these fields to talk to the runners and interact with them so that their concerns and issues can be resolved to some extent. We did have the first episode of Surgeon Wellness Tries last week with Dr. Avid Nair for the back. Today, it gives me great pleasure to introduce to you Dr. Rakesh Nair, who is an extremely renowned exclusive knee replacement surgeon with over 24 years of experience. Practices at some of the leading hospitals in Bombay, including Hinduja, Holy Family, and Zen Super Speciality Hospital. Dr. Nair brings with him a wealth of experience as a knee replacement surgeon and has performed over 2,800 knee replacement surgeries over the years. Well, one good thing about Dr. Nair is that he continually abreasts himself with the latest trends and technologies vis-a-vis knee replacement surgery. And you'll often find him traveling overseas for learning new modalities, including computer-assisted surgery and robotic surgery. He's been and very active proponent of preventive treatment of osteoarthritis of the knee and has had many articles published on this subject in various medical journals and in the newsprint. You can know more about Dr. Nair on www.kneecarecenter.com. With such laser focus, especially for the knee joint, Sorgen is really privileged today to have Dr. Nair here to guide our runners all about their knee concerns, right from prevention to care and even dealing with knee pain while running. Thank you so much, Dr. Nair, for giving us your time. I know you've just wrapped up your OPD. You've not even had time to breathe. And here you are starting the webinar. Thank you so much, Doctor, for being here with us. Thank you and welcome.
Welcome, Achal, for your kind introduction. Tell me.
So, Doctor, we have a lot of runners listening to this webinar, and we've been flooded with loads of questions from them. Before we get into the questions asked by them, I would just like to touch upon a few, tips on introduction of, how runners should kind of take care about their knees. So from your experience with patients coming in into your OPD every day, what is the kind of issues you've had or concerns you've dealt with runners for their knee?
So before I tell you what we should do to prevent injury or in strengthening, I would like to put a point across where I would like to just show you a simple model of the normal knee joint. You have to see what it looks like. So when I talk about the femur, which is your thigh bone, when I talk about your tibia, which is the shin bone, you understand as I discuss further what I'm talking about. So this is the bone on the top of your knee. This is the bone on the below the knee. Between bones, there is the main cushioning, which is your cartilage and the meniscus, which are your major shock absorbers, which are they're supposed to be lasting you a lifetime. That's why I said, I don't know the age group I'm talking to, but whether it's a 20-year-old who's running or an 80-year-old who wants to walk fast and run, it all depends on how much you want to really save this cartilage. So before we start anything, understand that you have 1 centimeter of cartilage which the Almighty has given you, and it should be lasting you a lifetime.
Wow.
That's about the knee. Now, coming to your question again, Achal, what was it again? Just tell me that. What was it?
Any common concerns that you've faced all across the patient group that you've had so far vis-a-vis running?
Let's address it as colleagues and friends and juniors and seniors. They're not patients as long as they don't have any knee pain, right?
Okay.
Here now, since the last few years, I would say last 10 years, I think marathon running, or rather running, has become a fad in town. It has increased my work in leaps and bounds on a very sad note. Means, when I talk about the patient, because everybody just wants to run. Irrespective of the size and shape, they all want to run. Where they figure out that only running is the only form of exercise. So that's one thing which I would clarify right in the beginning. There are other forms of exercise also besides running. So most of the time, it is a problem between the imbalance between how much you are strengthening the muscles in the front of the knee and how much you are using it in terms of your running and jumping around. So we get a lot of patients with a lot of knee pain because they have not trained properly for the running or the walking which they are planning to do.
So it's really important to kind of know what kind of problems you will face when you embark on this running journey before you start running.
Yeah.
So you can take
So
care. So if you can guide some
age
tips on
group.
that.
So if I say age group wise, I said, now if you tell a 20-year-old to do exercises, do this, do that, he's just going to look at you and say, "Shut up, old man. You're not in my league." So I wouldn't want to give this advice to the younger generation for a 30-year-old, understanding that even if there is damage to the knees in that age group because of excessive running or whatever form of exercise they do, the
Right.
body is in a position of reversing that. That's
Awesome.
that's a self regeneration, which they say, which happens around 30. After 30, it is only going to be wear and tear. So that's very important for runners who have not really been in the exercise module before and who want to start running. So somewhere in the 45, I think I've seen a new fad where I think 50% of the people I who are running are in the age group of 45 to 55. Or
Right.
correct me if I'm wrong, because it's a little mid gap there where they have really not focused on their strengthening and they just start running. They talk about flexibility, they talk about stretching, but that is not enough, good enough when you talk about running. The
So we mustn't.
intensity of the run has
Mhm.
to be balanced out with the amount of strengthening you end up doing.
Right. So we
And
mustn't confuse strengthening with stretching, basically.
exactly. And plus cardio is different and strengthening is different. Like if I explain to the patient, when I ask the patient, what do you understand by exercise? And he says, I walk. For me, walking is abuse when it comes to the knees. Because if you walk without strengthening the muscles around the knee, you're going to cause damage to the cartilage and the meniscus around the joint. One other very important feature where I tell a 40-year-old, so I'm really talking about the a little middle age group where they have not really, they want some form of exercise, but they get into it very fast without addressing that there could be problems afterwards if they
Right.
don't do it the right way. A basic calcium, vitamin D, and a B12 blood test for all ages. I would say even if it's a 20-year-old, you need to get these basic blood reports done.
Mm-hmm.
If they have to be in the normal range, if they are not in the normal range, and if you exercise, you're going to cause damage. After the damage, if the body doesn't have the basic ingredients of bone, which is your calcium, D3, B12, it is going to take a lot of time to recover. So I would say that 20 to 30, 35 age group, irrespective of what you know, before you start any form of exercise, it's very important that you do your calcium, vitamin D3, vitamin B12 blood test. Show it to your general doctor. See that it is always maintained on the higher side. You will see two options there. You will see a basic range there, and most of the time you're there on the bottom rung of that range. So just because you're there on the bottom rung of the range doesn't mean it's normal. See that you are on the higher side of that range of that vitamin D and B12 so that your body has some material inside to prevent or to correct the damage which you have done with the exercise. Another
Right.
very important part is, especially in a 40, 45-year-old lady, I tell them you have to do a bone density. When I talk about a bone density, I talk about a DEXA, that is a DEXA, because it involves the whole body. So we do a bone density which involves the spine, the hips, and the forearm. So, overall, because of menopause, because of thyroid, whether there are any issues in your bone. So the females in the age group of 40, 45 should get your blood test done and also the bone density. And depending on that, you should decide whether I'm ready or whether I should start running. So this is for the people who are deciding to look at running as a form of exercise.
Okay. So what you say is across the board, basically across the age group, right from a beginner, I mean, right from a younger age, whether it's 20s, 30s, 40s, 50s, the bone density and the D3, the D3 calcium and the B12 is a must for all runners.
I'm not asking a younger patient to do a bone density. I'm talking of somebody,
Yes,
ladies in the age group of 40 plus to do a bone density and the blood reports, but somebody in the age group of 20 should do your blood reports at least so that there is no deficiency state before you start exercising, or rather if you start running.
correct, correct. So this is really important. And then obviously to consult their doctor and to know if there are any deficiencies, then to take them. And then you also recommend them to start with strengthening exercises, irrespective of their age, and especially above 30.
Yes. So they need to do strengthening. I would put strengthening as a primary line. Now let's go step by step. Let's talk about people who are
Yeah,
just about to start running. Let's
right.
first phase. We're not talking of the runners. We'll come to the runners afterwards. But
Mhm.
first thing is when you're deciding that I want to look at running as a form of exercise. So you
Right,
got your basic blood reports done. They're good, fair enough. And then you start. You have to have gymming as a form of exercise, or even if you're doing it at home, you have to go to the level where you're doing it with light weights at least. While you're strengthening, you decide on brisk walking immediately. I'm talking of the earlier ones. And if you feel you're doing that very comfortably without any aches and pains, a gradual jog is good. Now, before I forget, I said, what are the options of jogging? Where are you jogging? Where are you running? That is very important. It
you
is
mean
very
the
important,
surface?
the surface on which you're running. I see a lot of people running on the road. It's not, it's simple logic. Like, you're going to run on a hard surface on a daily basis, it is going to cause damage to the knees. So either a grass or a clay, or we're looking at basically even in the garden, you can take the rickshaw, take the car, go to an area, go to a base which has got a mud base or a grass base. Firm, semi firm. We're not talking of jogging on the beach. That is high intensity. The sand there is going to really create
Right,
high demands on the knee. So when you're talking of jogging or running initially, you can, when you're walking, also see that you're walking on a mud track or a grass track. Road is an option, but that's not a very good option. Another thing is good shoes. Invest in a good pair of running shoes. It does not have to be a really high end level, like a high level or very costly shoe, but I think nowadays a good pair of shoes you get between 5 to 10,000 rupees. But that is the most important investment you can do, so that that brunt is taken by the shoe and not the brunt doesn't come back on the knees when you are running.
right,
This was the first level. In case actually you want to ask me something, we can. This is for the beginners. I'm sticking to the
right,
beginners.
right, right.
Then
So
you
let's
look
go
strengthening.
to the next stage. Like,
The
suppose the.
next level is now I have people who are running.
Mhm.
Now they have a marathon coming up in 2 months or whenever it comes up. And then they still run on the roads because that finally they say we are running the marathon on the road, doc. What are you saying? How can I practice somewhere else? So
Right.
there is something called as cardiovascular activity. Your stamina can be increased even without running. Now, how's that? How do
Mhm.
you use the stamina for the final race, which you are really interested in running the marathon without running on the road?
Right. So
You have alternate
you have to
forms.
keep your knees safe as well. So
Yeah.
please guide us
So
how.
you want to increase your stamina so that you can do that 5 kilometer, 10 kilometer, 15, whatever you're running. So your stamina can be increased by swimming and cycling too. Understand, these are non-weight bearing exercises which will help you increase your stamina.
Mhm.
And really, on the day when you really have to run, you can use the whole strength of that to run on that road there. But before, at least when you're practicing, at least don't damage the knees.
This is a very
The
interesting,
point. So
doctor. Yeah.
you have to indulge in. So I said a practical aspect is cycling. If you're running, you can definitely get hold of a cycle also. Swimming may not be practical for
For
everybody.
everybody. Yeah.
But cycling is something where you can definitely increase your stamina, where you are deciding that 10 kilometers, I can make it 15 kilometers just by increasing the stamina during cycling, because you're not causing damage to the knees. In case you're not, the regular surface is not there. So in a week, if you're training, if you say, I want to train every day, I would suggest balance it out between cycling and swimming in terms of the cardio and
Right.
muscle strengthening, so that you run twice a week if you're preparing for a major event, but you see that you cycle twice and swim once at least, so that your stamina is taken care of and there
Mm.
is damage done to the knees.
Wow. This is extremely insightful, doctor, because as you rightly said, before any marathon, you see a lot of runners on the road, and invariably or unknowingly, they're damaging their knees. And we need to preserve the knees for, a longer period of time, because then the runners want to run for many more years ahead. True. That's very, very interesting. And yeah, and in terms of people already with a knee pain, some sort of a knee pain or the other, what would you guide them who are running, like runners who already have some sort of a knee pain?
So first of all, you need to really show it to an orthopedic surgeon to decide now whether you are. See, it's a balance between whether you really want to damage your knees to a point where it is not reversible, or whether you want to go back to the strengthening and then go back to running. So,
Okay.
but that has to be with a consultation with the doctor, because he assesses the damage, which very fact there is pain means there is some damage to the knee. So it is
Yes.
going to be, graded as a mild osteo, whether depending on the age group again. If it's a younger 20 to 40, then you're looking at a ligament strain, or you're looking at some damage which can just get better with a little rest and strengthening gradually in terms of the muscle. But if it's a 40, 45-year-old, a simple X-ray will tell you how much of damage has been done. Bottom line, that it has to be rested, shown to a doctor, and then depending on how much the damage, we decide what the problem is and how we can take it forward.
So if there's any sort of pain a runner is encountering or experiencing with the knee, they have to show it to a doctor first.
It is very important. You understand that the body gives you signs. It is telling you that there is something wrong.
Right.
Bearing the pain is going to cause more damage. Where as you get older, if you're a 40, 45-year-old, you're going to cause more damage by just pushing it more. So final word is the rest. Now, how much you need to rest is the balance depending on how much of damage you've already caused in the knee, either with an improper exercise or whether you've been running a little more. So that 1 week, 10 days of rest is primary. Ice always helps. Remember that even after every run, you can always use ice.
Okay.
Ice will definitely reduce inflammation, even if there is an injury or not an injury. So we're talking of people who really do hardcore running. When you're running 15, 20, no pain, don't wait for the soreness to come on. Apply
Wow.
10 minutes, 15 minutes ice after a workout, whether it is there, especially the area which you're using more. In
Right.
terms of knees, you ice the area. That acute inflammation is immediately reduced. Your swelling is reduced. Your pain will immediately get bad. It will get a little less. So ice can always be used in people who are after an extensive or a strenuous workout.
Even if they're not experiencing pain.
Uh, See, it's like they will have that dull ache. There is
Right.
it's all in the mind. That in the mind he's saying I have no pain, but then he has to be a little loose and say, "Oh, am I getting pain? Let me ice it." There is no harm in it. So it's not like like if you say I am fine. I can control this pain. I can manage. संभाल सकता हूँ मुझे इतना दर्द हो रहा है पर मैं उसको सहन कर सकता हूँ
Correct.
सहन करने में आपका अंदर का सूजन कम होने वाला नहीं है so
Right.
just by
Right.
saying that I can bearing the pain doesn't mean that the inflammation inside is getting less. So
Correct.
you have to be a little non-egoistic on this point and tell yourself, fine, if there is slight ache there, there is no harm in,
I see.
using ice there to even take care of it without taking any additional medication.
So despite the icing, if pain still persists, then they have to see the doctor.
There is a problem. So,
And
that ache, obviously somebody who's been exercising on a regular basis understands the difference between an ache and pain.
exactly.
You
So
have that exercise ache, which and the issue is those aches and pains which were there at a younger age group don't disappear as you get older. That is the sad part.
correct.
I've
Correct.
experience which I've experienced through the years. You think it would go, no, and it doesn't go. So then you realize that you're not getting younger. It's there. It's wear and tear, and you've caused a little more damage. So it's important.
So,
Excuse me, you consult a doctor.
my next question would be, are there any common misconceptions about knee pain in runners that you would like to address?
So it's not about misconceptions. I see people using a lot of supports when they're running. See them use
Yes.
kneecaps, this. So
I was going to ask you.
understand that, it's simple. The knee is telling you that it is not strong enough to take the brunt of the load of what you're doing. You're
Mhm.
using an external support, which is wrong, because that should be the job of your own muscles to support the joint. So you have to tell yourself, I should be run what I can do without any external support. Otherwise,
Right.
once I do the support, the damage inside is going to be much more. So you're causing more damage by using a support. Although you can run and you feel nice, but the problem inside is going to increase. So again, the misconceptions on where you run and whether running is the only form. I said, no, you have alternate forms of cardio for yourself. Yeah.
So basically, if you feel the need to wear a kneecap, which means
There is
your
a
knee is
problem.
asking for attention. Yes.
Yes.
All right. Thank you so much, Dr. Nair. It was these tips and these points were really insightful. We have a bunch of questions in the chat box. So,
Sure.
with your permission, may I start taking those questions?
Yes, please
Is
do.
there anything else you would like to address our audience, or you would like to
Questions
interact
come
live?
as the questions come. I think I can just start with a note. It's a different thing. I don't know. Everybody may not take it the right way.
Yeah.
Now, if you look at running as a form of meditation, understand? If the runner is totally in the running, at some point, even if he has to stop running, he will not feel so bad. Now, you try to figure out what I said now.
Okay.
Being like, see, I get a lot of patients now, 55, 60-year-old, 70-year-old, who is
Right.
running, who has been exercising regularly. But
Right.
then when I see his X-ray, I know heart to heart that I
Hmm.
think it's done. He has used his knees up badly, and if
Right.
you give him any form of surgical intervention, that will
Right.
be basically for him to lead a very nice life, comfortably walking, running, walking rather, I would say. Running
Exactly.
would definitely damage the operated leg also,
Yeah.
but he or she is not ready for that. For them, it's like a blank thing. How can you tell me, doctor, that I cannot run? I said, I have not told you that you cannot run. I'm trying to tell you that if you had been running in full consciousness all through all these years when you were running, the need to stop running, or when the body tells you that I don't want to run or I cannot run, you would accept it. So
Okay.
I'm telling all the runners in the younger age group now, while you're running, be in the running. Don't think here and there. Run so much that if at any stage you will have to stop or reduce the running, I'm telling you, you will not feel so bad if you are in the moment when you are running.
I get it. So what you're trying to say is,
Acceptance.
whenever you're running, enjoy the moment so much.
Exactly.
Yeah.
Exactly. Be
Yeah.
in the moment. When you're running, don't be, it's very easy to put on the headphones and run and do all that. No, run. It's like I would say, just be in the running. Do that one running as an act, and I'm telling you, you will feel like running. You will not feel like running. Whatever happens, you will not feel bad at the end of that phase when you have to stop or reduce it at some point. But if you are not in the moment, if you don't run with everything when you run, it is not going to make you that happy in the end.
Right. So I think the take home message is that to keep doing your strengthening and keep your knees safe for as long as you can. Keep them, and yes, also enjoy the run, enjoy the moments that you're running. So thank you so much, doctor. We have Hemant here who has a question. Hemant, you can unmute yourself and ask your question if you're around. Else I'll just read the question. Hemant, are you there? Then you can unmute yourself. Well, okay, I'll ask his question. He says, is it safe to keep on increasing the mileage and do more frequent long runs, like more than 25K? If not, then how often should we do long runs?
How old is Hemant?
I have no clue if Hemant is not here. He's not
So basically, you're doing a 25K a month. It's impressive. Understand? So I think you're in the right mode where you can definitely increase your running. There is no harm in increasing your running as long as it's balanced out with your strengthening. So I have patients, or rather, I would say I have a lot of friends and colleagues who say that we have no problem when we are running for the first 15 kilometers. My pain starts when the 16, 17. So I just told them, take 2 steps back. When I say take 2 steps back, increase your exercise strengthening, and you'll be surprised that you can run more.
Right.
You want
Right.
to run beyond 25 kilometers if the body is saying no problem, no harm. But see that it is balanced equally with the strengthening. Means you cannot run more and exercise less. The exercise and means basically the strengthening and the running has to be balanced.
A very key take home message here is to listen to your body. If your body is
It
saying,
sends you enough signals.
I'm
You
sorry?
have to be open to your body sends you enough signals. You have
Right.
to be open to the signals which the body says, and there will not be any damage.
Correct. Thank you so much for that. Hemant, I hope that answered your question. So we have Mr. Suren here, and Suren is right here. And Mr. Suren, please ask your question. You can, yeah.
Hi, good evening, doctor, and thank you for taking this session. Sorry, I'm in a car. I don't know my audio is
And you're
coming
audible.
correct.
Tell me.
No,
Okay,
you're
wonderful.
audible.
First of all, I must say I loved your comment on meditative running. I'm not a frequent runner. I do outdoor cycling and couple of times in a week.
How young are you, Suren? How young are you?
52.
Great, beautiful age to be at. Tell me.
Okay, so but I've been wanting to do a bit of running. I have a history of both the knee surgeries. One for discoid meniscus many years back when I was in college,
Right.
and second is just 4 years ago for a complex ligament tear.
Hmm.
So I've done in the past, the Oxfam walks of about 100 kilometers plus, etc. But I'm just curious to learn that, can one do at this stage those kind of stuff? I've stopped doing it after my surgery, just last 4 5 years ago.
How
But
intensive has your post-op regime or your muscle strengthening regime been over all this time, Suren?
it's regular. I mean, as I said, 2 to 3 times in a week, I do gym and I do
Means you
bit
do,
of
no, I'm talking now, since we're running, we're not running on our hands. So I'm looking at saying how much you do work in terms of strengthening your quadriceps, hamstrings, in terms of the lower body strengthening, twice a week at least.
yeah, twice a week. You
It
can
didn't sound
on
convincing.
yeah,
So
on an average twice a week.
no, I'm trying to tell you is like you have to have
Usually
it at least twice
it
a week.
ends up being a circuit. So since you asked the question,
Huh.
lower part strengthening, so therefore the confidence was a little halka.
Right. No, the circuit training, what happens is we give a little more effort to the upper body in terms of our biceps, chest, biceps. You understand? When it comes to like default, I know how it works. It goes for once a week there. So, like that 1 kilometer session for a runner is not going to work. So you have to first increase the strengthening to twice a week.
Okay.
Right? Do that, saying that I want to run, walk. So, and before we start running, you're going to first walk. Do your brisk walking first. What you've been doing, what you've been doing. At no point there should be pain. Right?
Right.
And then as you feel, if you're comfortable with your strengthening and then you're walking comfortably, you can start with a 1 kilometer, 2 kilometer gradual, as I said. And there the track on where you're running is important. Please don't start running on the road.
Okay.
So the mud track or that grass track, wherever, even if you're going to the garden or you're going to some place where you can run, that is very important. So, like, and again, if you feel 1 kilometer, 5 kilometers, I'm comfortable, fair enough. Gradually increase. So balance out the strengthening with the running. There is no harm. But if it is not so, means your knees are not strong enough to take the brunt of that. The whole brunt is coming on the cartilage.
Right. Okay. So it's not a no with this.
Nothing is a no. Nothing is a no here.
Okay.
It's like, and I said rightly, as you remembered, you have to get your calcium, D3, B12 blood test done. Understand?
Right.
That's important that those are on the higher side. Mehta, are you a vegetarian or you eat eggs?
No, vegetarian.
Eggs is vegetarian here, Mehta. You get those which you get those eggs which don't give which are not fertilized. But no, right, that's what I understand. So here, this is again a very important, very important thing, which is about diet. It all comes down to diet also, where we're looking at protein in some form. Vegetarian form has a lot of protein, but your blood reports are important in terms of your D3, B12, so that you eat right and eat well, so that there is, someone in your body when you are going to cause injury or damage, there is something for recovery.
Fair point.
So
good point.
Everything comes into play. It's not one thing.
Right. And the strengthening has to double up.
If you want to start running, it has to go to the next level, sorry.
Yeah.
No, thank you. This
Right.
is useful.
Thank you. So we have Dr. Aarti here, Dr. Aarti Zanwar. Dr. Aarti, if you're here, please unmute yourself and ask your question. Yeah, Doctor.
Hello.
Go ahead.
Yeah, Aarti, tell me.
Yeah, sir. Sir, you talk about the ferritin, vitamin levels and all. So I want to know about the serum ferritin. How significant is to do serum ferritin level, and its range is very vague. It's like a 17 to 200 something. So where should be our serum ferritin level?
So understand one thing, that this serum creatinine again is something totally different in terms of kidney function.
Ferritin.
She's talking about ferritin.
All that, so I don't understand and I don't know. I'm just trying to tell you that simple logic is that your body should be supplemented ideally with natural food. Understand? So this ferritin levels, all that is, there are other reasons why your ferritin might be high or low, that, a physician would be in a better position to explain that. But that is not concerning the exercises in terms of running. It's a different thing altogether here, Aarti. Understand?
Okay. Yeah, thank you, sir.
Yeah.
All right. So I think Kamlesh's question we have already taken in the session itself. He's asking whether wearing a knee support helps while
It'll help, but it will cause more damage in the long run.
Kamlesh, you can unmute if you're there, and you can ask something else if you'd like to. Well, yeah, Kamlesh, please go on.
Yeah. Thank you, Doctor, for this session. Very insightful. So I actually, my question was regarding the knee support. So I don't have any knee injury or any problem, or even post-workout, I do my stretching and all.
How
It's
old
fine.
are you, Kamlesh? How old are you?
I am 48.
Good, good. Tell me.
And
Yeah.
I do my workouts and all. I've been working out for the past 25, 30 years now.
Beautiful.
So leg workouts also once or twice a week. I do my squats and lunges and all. So
Right.
those things are in place. I do cycling also from time to time. I just wanted to know, I've seen a lot of runners on the road wearing knee supports while running. Although
Right.
I've not tried myself, I just wanted to know that does it help in terms of, providing some sort of a support to the knee? Because for the first time now, I'm going to be attempting the TMM 21. Although I regularly run 10, 11, 15 also I've ran, but 21 I'm attempting for the first time. So I just wanted to know out of curiosity that wearing a knee support, would it help in terms of, avoiding any sort of injuries?
Right. So, Kamlesh, understand now why the body is sending you signals. When I say body is sending you signals, means body बोलता है कि इतना भागेगा तो मैं ठीक हूँ. That support will help you run a little more, but once you remove the support or without the support, there will be damage inside in your knee in the long run. So it's like an external muscular support, which you should ideally you should make it strong with your own muscles, with your own strengthening.
Correct,
So
correct.
I wouldn't recommend any external support because you will be comfortable. You will be surprised. You might be able to run an extra 5 kilometers because of the support.
Okay.
What happens inside, Kamlesh?
Correct.
The brunt is gone on the cartilage because the support is an artificial support. It's not your own muscle.
Correct, correct. I
The
understand.
moment you remove the kneecap, you will realize कि boss ये क्या है? And you try doing the same thing without the kneecap, it's going to cause damage inside. So I would not recommend a support in terms of any long run or anything in terms of
Understood. Thank you very much.
Probably taking your tip on icing post the run will be a better bet.
Okay.
All right. Thank you, Kamlesh. We have Shreyas here. Shreyas, are you there to ask a question? Yeah, please go ahead.
Yeah. So thank you so much for this valuable insights that you have given for the run part. So my name is Shreyas. I am 44 years old. So I also wanted to run that. I have been running like a 21 kilometer. I've participated in this runs for 21 kilometers. But like you had rightly pointed out, so around 17, 18 kilometers afterwards, there is some kind of a formation around the knee. So it's like a lactic acid formation, or that's what I'm assuming, which ensures that it does not let you run further. So apart from the knee strengthening exercises, is there anything else that needs to be taken care of?
Right. So that is the most valid point there, where the body is sending you signals. It is saying, Shreyas, you're fine to run 17 kilometers, right? So now beyond that, there are some issues which are happening. So while you're saying if you're strengthening it or you're increasing your strengthening, that is one part. Then you have to see your basic parameters. I don't know about hydration, how much you're allowed to drink water in the middle. You understand? And whether you'll have your salt. So all this, that tightening can happen even because of your sodium, potassium, normal common salt, what you're drinking, and sugar, what you're having. So those levels there, do you hydrate yourself? Are you allowed a little? How does that water work?
Yeah, so I mean the hydration stations are kept every 3 or 4 kilometers.
Hydration is only water, or is there salt? Is that, what I'm talking of, potassium, sodium?
Yeah, so some of the rides, I mean some of the races, they have an ORS or a electrol kind of a thing.
Those will help. That is one part. Plus, you have to see that your pre-op test, which you've done of your calcium D3, B12, is everything on the higher side.
Okay.
Higher levels. It's not on the lower side. Like, if your calcium is supposedly between 8.5 to 10.5, it should be at least 9.5, 10. Vitamin D normally should be between 30 to 100. Yours should be at 80, 90. It should not be at 30, 31, 30, 35. Similarly with B12, which should be between 200 to 900, it should be somewhere 600, 700. Not in that 200, 300 range. Bottom line, everything, all your basic constituents of bone and nerve should be on the higher side. And hydration in terms of salts, your common salt, all that should be there available when you are running. I think that should address your problem there.
Okay, thank you so much.
Yes, Shreyas.
Thank you, Shreyas. Thank you for being here. And we have Satish Shinde. Satish, if you're there, please unmute and ask your question. So,
Very good evening, doctor, and very
Hi,
good evening,
Susan.
ma'am.
hi.
Actually, sir, I'm 38 years old and I have varicose veins problem. But while running now, I don't feel any kind of pain. So, is it okay to run with varicose veins?
Yeah, see, again, now there are specialists where for varicose veins. Running is a very good thing for varicose veins because it will increase your circulation there. Understand? But
Hmm.
whether you need to, how bad, there are different grades of varicose veins severities, which again, the specialist will tell you whether we need stockings, whether we need any external aids to help you for the varicose veins. But running per se will not cause any damage to your varicose veins. I would recommend running also within limits of pain if there is no pain, but you need to show it to a varicose vein specialist if there is any medication which can be parallelly started along with external support like stockings.
Correct.
Okay, sir. Thank you so much.
So,
So, one more
definitely
question I want to
consult
ask.
specialist.
Ma'am, can I ask one more question?
Full
Yeah,
Naput,
please do, please do.
Yeah. Sir, actually, near my Libya area, the near, not in a knee, but under the knee, na, I'm getting some different kind of pain basically. I don't feel this pain while running or after the running, but when I get up by sitting position, na, I feel this kind of pain. And since 2 months it's happening.
This needs to be seen by a doctor. It could be because of the nerves also, and it can be because of the circulation. But at the most, you can look at icing. You see if icing helps. If not, then you need to consult an orthopedic surgeon to guide you further. Satish.
Oh, okay, sir. Thank you, Lord. Thank you so much.
Do try icing and then you can take a call on the next step.
Okay, ma'am. Thank you, Lord.
Yeah, thank you. We have Mr. Nikhil Sawant. Mr. Nikhil, you can unmute yourself and ask your question if you're here. But before Mr. Nikhil does this, I think Arjun has put in the chat box that there's no option to unmute. Arjun, there will be once we are taking questions line by line, and when your turn comes, we will give you the option to unmute at that time. Thank you. Yes, Nikhil, please go ahead.
Yeah, hi, am I audible?
Yes.
Yes.
Yeah, thank you. So I am 25 years old, and I've been running since last 4 years. But recently, like past few months, I'm getting this lateral knee pain on my left side, and like I'm also feeling like the left leg running form is different than my right leg running form.
How much are you running, Nikhil?
42 kilometers.
40 kilometers.
Yeah.
Yeah. So basically, again, the bottoms down to the same thing. Your legs are not strong enough for the 40 kilometers. First, what you're going to do is you're going to reduce the duration of how much you're running, the distance.
Okay.
So, pehle 20, gradually as you're doing it. And how often do you run, Nikhil?
2 to 3 times a week. So
Yes.
different kinds of running,
So
easy
now
run,
first
tempo
you
run.
reduce it to the minimum. What is your minimum now? If I tell you which you won't feel bad that you can run 10 kilometers, 15 kilometers.
21 is okay for me.
So you first touch your basic level where you're running and there is no pain. Understand? Go to a point and tell me at what level the pain is coming on or if there is any pain coming on. So again, there is only an imbalance between how much you're strengthening and how much you're running, Nikhil. Nothing else.
Okay, but why is it like the left leg is different? The running form is different because with the right leg I can run like 50 kilometer and without any pain, but
Right.
for
But
left leg
understand
I'm
when
not
it's
confident.
left and right, na, every part of your body,
Yeah.
if it's the same body, is different. Nikhil, there could be some damage done to the left at some point, but I said your age is a very good age where that can recover fully. So if you're saying it's the left only which is as not not as good as the right, it needs to be addressed. You need to show it to somebody because this is a different thing altogether. There could be a little more damage to the meniscus and the ACL as compared to the right, while there will be no damage to the right.
Okay.
All right.
It
So
does not mean that it is.
Yeah.
It is all part and parcel of the wear and tear only, which is there is more strain coming on the left. You haven't realized it, and many a part what happens. You're a right-handed individual, Nikhil. You're righty.
Yes.
So always remember that the left is always the weaker side. In any part, your left is always a little weak. So the muscles of the right hand, right leg are default always a little stronger. No, it's natural. What I'm giving you is something natural, not so that also can affect it when you are doing high intensity, then this extra strength comes into play.
Correct.
Okay?
Yeah.
So
Okay. Thank you, sir.
do get yourself checked from your doctor, and then proceed ahead.
Okay, sure.
Thanks.
Thanks a lot.
So, Arjun, you can unmute yourself if you're here now.
Yes, thanks
Arjun?
for that.
Yeah.
Me and my wife, like I've been a regular kind of runner, but I wanted my wife also to try running. But then when she came across like running, and she was participating in a race called a Devil Circuit, and she kind of has a ACL as well as a meniscus tear. So the doctor has advised her that she need not go for any surgery, but she wouldn't be able to run at all. But if she can go for a surgery, then
How old is
she
she
may
now?
be able to run. She's like 36.
Right. So
So
then
in
maybe
that
I will
case,
say she will be able to. What I can tell you is that you need to address the ACL and the meniscus, and she will be able to run. Not maybe, I'm telling you.
okay, got it. And
Arjun,
also
understood. So,
she's on the heavier side as well. Like for
right,
a height of
right, right,
like 4'10", she's around
right.
80.
So very importantly, that why are you looking at running as an option? If you understand that, very importantly, she has to, because that is a very high intensity workout, Arjun. It puts 5 times your body weight on somebody who's not a regular exercise person.
Okay.
She has to start gradually. And when I say gradually, it is like, remember, what is losing weight, Arjun, according to you? How do you lose weight? By exercise, or there is something else into play?
I would say like food control.
So if I put a percentage on it, I will tell you losing weight is 80% food and 20% exercise.
Okay.
So what does that tell you? Bottom line is we need to first get her into a proper food diet and local strengthening, where you're looking at simple exercises to strengthen the quadriceps and hamstrings. You are at a different level. She's not, it's going to be difficult for her to immediately come to that level now. Understand? And her things are going to be with the cycling at the most, so that it's a non-weight bearing exercise, whether it's pre or post the ACL.
Okay.
We immediately go to the running. It's going to start with the walking, but as I said, that's all only 20%. She has to address the diet first, which will help in reduction of weight, and simultaneously we're looking at muscle strengthening. I wouldn't put running immediately as an option for her at all.
Okay, thank you for that.
Yeah.
So what doctor's trying to say is eventually she will, but you have to make it as a gradual move with the other options as
No damage to the knee now, because 36 again is a little forgiving. Because we're dealing with the ligaments there. At some point, if the brunt goes on to the cartilage, then it's not reversible.
Okay.
Right. All right. Thank you, Arjun. And we have Mr. Pradeep here. Please unmute yourself and ask your question.
Thank you, sir. Thanks for this insightful session. I generally I'm 33 years old, and I generally do lower body strengthenings. I mean, for the last 1 month, I've been doing strength lower body and upper body strengthening. But when you mentioned exercises specific to the knee, there are few on the internet, but is it something that we have to do on a daily basis? And can you suggest what are those knee exercises that we have to do?
So,
Strengthening.
looking at how often do you go to the gym? Twice at least you do lower body.
Five in a week, yeah, twice for
If
the
you're
lower.
going to be a runner, then at least twice a week dedicate to at least the knee. So we have the machines there. That's enough. So you have the leg, you have the leg extension for the quadriceps.
Yeah.
Sleeping on a stomach, you have it for the hamstrings. But always remember that you have to gradually increase it. So we're looking at starting from 5 pounds, 10 pounds. Do minimum at least 15 repetitions, 3 sets. 15 repetitions, 3 sets before you increase the weights. I have no problem with you increasing the weights gradually, as long as you're able to do 15 repetitions and 3 sets. Understand?
Sure. Yeah.
Do the leg press. At some point, if you're not very heavy, I think at your age, you can even look at your squats, because I'm not very comfortable with squats after 40, 45. If you're not, doing lower regular strengthening, but at your age, if you're doing the rest, even a proper squat is also fine, even with the weights on your shoulders. So you have everything with you at the gym if you're gymming. You don't really need to keep anything at home. And twice a week is more than enough.
Okay. Got it. Thank you, sir.
Thank you, Pradeep. We have Amit Talreja here next. Amit, please unmute and ask your question.
Hi, doctor.
Hi,
Thank
Amit.
you very much for the informative session. Doctor, about 15 days back, I did my MRI. I'm 42 years old. I got grade 3 horizontal tear within the body and posterior horn of lateral meniscus with small parameniscal cyst. measuring 2 by 3 mm. Now the doctor, I consulted the ortho. He said, you come back and think you might have to do a surgery. So I am little confused. So at this stage, whether is surgery required or not. I don't have any pain as such.
How did this happen? Did you have an injury? Did you fall? Did you strain yourself?
No, actually, it just started suddenly, and the pain started when I was just going down the staircase. When I was just going the staircases, about 20 days back.
A major injury or a fall or something? Nothing like that.
No, doctor.
So that's why I said the chances of you requiring surgery become a little less, but you need to be clinically examined. Again, as I said, you can always come and show it to me at some point, because if there is no relevant history of injury, the MRI always shows a lot of damage. It does not necessarily mean that you have to address it with surgery. But I said it varies from doctor to doctor, because I would like to assess you to decide whether you require any intervention or not. The way you're giving me your history, if there's no relevant history of trauma, we can get away with medication and exercise. But for that, I need to see you.
Okay, doctor. I'll connect with you, doctor. Yeah. Thank you, doctor.
Bye.
Great. Thanks, Amit. So we have Dilpreet, please go ahead and ask your question.
Yeah, hi. Good evening, Anshul. Good evening, doctor. So it's a nice session. So I'm running 42 years of age, and I started my running journey around when I was at 36. So initially 4 years, 5 years, I did well. Like I run half marathon, 2 or 3 full marathons also. But from last 1 year or so, I start getting the paining in my left knee. So when I get examine or MRI, so I got to know that my cartilage got degenerated. So now, is there any way with the exercises, or what is the way forward for me to get on my running journey back? So as of now, while doing small walk or small run, I'll start getting the pain in my knee.
Dilpreet, for the timing, at least there is no option about running, because even if walking is painful, you need to consult a doctor first, na boss? Means the damage is there. So we are going to be reversing, where we are going to try and correct the damage. To know to correct, we have to know what is the damage, and we work on strengthening. But presently, I don't think you're in a position for running is out of question here. I'm trying to figure out that we don't cause more damage, Dilpreet. So milna to you need to show me to decide whether we need to, at what level I can take it. But these are the early forms where you're saying degeneration dikh raha hai. So there is already wear and tear. If you don't do the right thing, wo damage aur badhte jayega.
So the surgery is the only option, or it can be generated through medicine or as exercise?
Dilpreet, मैं surgery की बात ही नहीं कर रहा हूँ. I'm talking of guiding you properly, where we rest the area, gradually start strengthening, gradually get you to walking, and then decide whether you're eligible for running.
Okay.
There's no surgery here. But to at least understand what the damage is, we need to see you properly first.
Right.
Yes.
Sure.
I think the suggestion would be to get yourself assessed and then take it forward.
No surgery here. I'm just saying assess you and at least guide you properly so that you don't cause more damage.
Right.
Right. Thank you, Dilpreet. Thank you, doctor. Yes. And we have Gaurav here. Gaurav, you can please unmute. Yes.
Thank you, Anshul. So thank you, doctor, for the insightful session. And yes, you spoke to the point in every word you said. So yes, the question is a general question which I have observed. It's not that I have faced this problem, but this is a question I have heard from many of the new runners who approach me. Because being an MRI admin and being into running for more than 10 years, I come across lots of questions. So this is a general question. I guess someone has asked in a similar way. So the question is like the runners, they don't feel pain in the knee when they are walking or they are running or they are just doing a casual walk or something like that. But when they do the squat, when they get up from the bed or when they try to sit, they find some kind of a pain in their knees. So is there a reason, is it due to lack of strengthening or any lack of the vitals that you spoke about D3 deficiency, B12 deficiency?
Now, when
is it because of that?
It's got nothing to do with running. When the patient says or the person says, I get down on the floor, squat, get up, means there's already a little damage done.
Okay.
These are in fact early signs of early wear and tear. So this would happen normally in a 41, 45-year-old also, where नीचे उठ के बैठने के लिए सीढ़ी उतरना चढ़ते समय they get the pain. So these are early wear and tear again. So this is not connected to the running in terms of where if you're going to be running in a knee like this, the chances of damage are much more. Understand? Again, this person, they need to consult the doctor to assess the primary cause कितना है. Damage कितना हो गया already. So these are first simple clinical signs when the patient says मैं नीचे बैठ के जब उठता हूँ मुझे तकलीफ होता है. मैं बेड से जब means when the knee is being bent, there are areas of the bone which are already there is loss of cartilage. उसमें वो और भाग दौड़ करेंगे तो और डैमेज होने वाला है. So this needs to be properly addressed by the orthopedic surgeon. This is very important.
Yes, and yeah, these runners are usually at
Running
the
की बात है,
range of
running तो दूर
30
की
to
बात है.
45.
It is going to cause more damage. There are these activities where the knee is telling you, जब मेरा पूरा knee आगे पीछे means अगर ये same thing which I'm saying, यदि ये पूरा ऐसे जब bend होता है तो there are areas which are cartilage घस गया है, वो area पे जब आता है तो इसलिए pain होता है. तो running तो की बात है, we are trying to salvage the cartilage which is there कि और damage नहीं हो.
Yes, yes.
They need to seriously address it so that the problem doesn't increase.
Okay, yes. Thank you so much. I will just pass on the message to other runners then.
Yeah.
Right. Thank you, Gaurav, for being here. We have Robbie, who has a question.
Yeah. Good evening, doctor.
Good evening. Tell me.
So I have been in practice for more than 2 years and done some 20 mile around to that. But one of my knee right side is having a underpronation, and while moving also I have a body has every step it is having a dug in that. I changed various shoes and tried to adopt, but still it is could not be. In the lesser speed, I have a pain in my knees. But when I speed up, then there is nothing in. That is because of the most of the time which the body weight is in the air. I don't have any issues. So
How old are you? How old are you?
I am 49 years old.
So again, the question is self-answerable. You only answered it. Like, do you get pain when you're walking?
Not walking if it is in the phase of around 7.5. I have a mild like a pinching.
So your
Pinching.
strengthening is not balancing out the running. Simple. You have to work on the muscle more now.
Okay.
What happens is if your strengthening is not in the balance, the muscle, the whole weight which should ideally be taken by the muscle and bone goes on to the cartilage. And that's when the pain starts. So you have to go to the point back where you have to seriously address the strengthening of your hamstrings and your quadriceps.
Okay.
Go 2 levels back down first now. Stop the running, increase the strengthening, and gradually try and increase the walking and running.
Okay. Thank you, doctor.
Yeah.
Thanks.
Great. Thanks so much. We have Ritam Sinha. Ritam, if you're here, please unmute and ask your question. Ritam, are you here? Meanwhile, there is Praful here who wants to ask a question. Praful, please unmute and ask your question. Praful, are you there? Okay, then we will go with Shobhna. Shobhna, you can unmute and ask your question. Okay, well, I'll ask their questions. They've put them in the chat box.
Yeah.
So Ritam says, in some such cases of imbalance between strength in 2 legs, do you recommend to strengthen the left leg a bit more in terms of more repetition, or just holistic strengthening will help?
No, equal strengthening on both the sides. You don't work on one side, you have to work on both.
Okay, great. Thank you, doctor. So Shobhna is here, I guess. Shobhna, please ask your question. Shobhna, you've unmuted, so please ask your question. Well, I don't know where she went. So we have Sonal here who's raised her hand. So Sonal, you can please unmute and ask your question.
Hi, a very good evening, doctor. Good evening, Anshul.
Hi,
That's
good
Sonal Chopra,
Thank you. Thank you for the
pink champion.
wonderful session. Acha, doctor, I'm running 53 and I'm into my full marathon.
Yeah.
Okay. But the knee strengthening exercises which you have mentioned, I do it with my own body weights. Like I don't go to a regular gym or such. I do
Right.
my squats and all with the weights, but not with the machines. So is that enough?
So now, good, I know you, Sonal, so I know how much you weigh. What I'm trying to explain to you is that at some point, that body weight is not enough weight. What my question, what I'm saying here,
Yeah,
is like
yeah, yeah, yeah.
using seats. It works both ways. Very comfortably if you're able to do your squats and everything with your own body weight, means it's superb. But it is not, you have to add more weights at some point where you have to do more strengthening. For that, you'll have to look at the gymming part of it.
Okay.
Sonal, you put your whole body weight, there is a particular amount of weight your body is carrying, which is being transferred to the knee. You are comfortably doing it, but now to strengthen it more, that weight is not enough. So
Yeah,
you
so like,
once
sorry
a
to
week or twice, yeah.
So if I take the dumbbells, like, if I have a 10 kg or a 5 kg dumbbell with it.
But see,
So you,
using it as a body weight and then locally instead of doing means you have issues with the gymming or you don't want to gym.
no, I've never tried out gymming, so this has been my pattern regularly.
Right. Agar
So,
once a week at least, going to the
okay,
gym, just we're looking at leg extensions and just two major muscles there. We're looking at
okay.
the leg extension and we're sleeping on the stomach. We're looking at for the hamstrings. थोड़ा
Mm-hmm.
खाली excursion करके just try it. At no point should your pain increase. But now when you have already exhausted your body weight, वो dumbbell से ज़्यादा it is better doing the machines which are synchronized so you don't cause damage, especially for the first time. वो dumbbell लेके एक हाथ loose tight हो गया weight, you will get pain somewhere else, lower back. So there is something called as stationary exercises and something which is movable. What you're doing is mobile and which is very safe. You're doing it very well. But I would advise that at least once or twice a week, or initially just start with just the leg extensions. Don't involve too many parameters. Leg extension जो gym का है, minimum weight डाल के 15 repetitions कर, sleep on a stomach, do it the same for the hamstrings.
Right.
Try it at least once a week.
Yeah, thank you so much. Thank you.
Great. Thanks, Sonal. Thanks for being here. We have Mr. Sambhaji Deshmukh. Yes, please ask your question.
डॉक्टर नमस्कार.
नमस्कार, बोला.
मी 3 मॅरेथॉन रनर आहे. ऍट द एज ऑफ 51 लास्ट इयर 50 आय स्टार्टेड रनिंग. आतापर्यंत मी 7 हाफ मॅरेथॉन 8 हाफ मॅरेथॉन केले आणि सातारा हाफ मॅरेथॉन थोडं टफ असतं हिल वरती. ते उतरल्यानंतर माझ्या पायाला गोळे आले. त्याच्यामुळे मी ह्या मॅडमचे सॉर्जनचे सॉक्स घेतले आणि ते घेतल्यानंतर आता मी 2-3 मॅरेथॉन धावलो. चांगलं वाटलं, बरं वाटलं. पण डॉक्टर मला 2020 पासून कोविड पासून एक सवय लागली आहे. मी 22व्या मजल्यावरती राहतो आणि 22 मजले उतरत नाही पण चढतो एकदा. सकाळी वॉकिंग करतो मी 5 ते 6 किलोमीटर आणि त्याच्यानंतर आरामात मी 22 मजले चढतो. मला काही त्रास होत नाहीये. पण फक्त आज मला तुमचा एक संबंध आला म्हणून मी तुम्हाला प्रश्न विचारतोय की ह्याचा काय मला पुढे प्रॉब्लेम होऊ शकतो का?
तुम्ही राहता कुठे संभाजी?
मी ठाण्याला राहतो.
माझा नंबर ठेवून द्या.
हो, ओके. मी तुम्हाला भेटतो. चालेल.
असं नाही, समजून घ्या, ऐका. म्हणजे आपल्याला देवानी 1 सेंटीमीटरचं कार्टिलेज दिलेलं आहे, म्हणजे 1 सेंटीमीटर दिलेलं आहे. समजलं? सध्या तरी तुम्हाला आता निर्णय घ्यायचा की मला, आणि हे आमचं आयुष्य मिनिमम आता काय असतं, 60% लोकांचं जेव्हाचं माझं ऑपरेशन करतो ते 75 to 85 वाले आहे.
बरोबर.
तुझं वय काय आता?
माझं वय 51.
तू ऐक, समजलं तू मी काय बोलतोय हे? तू पळणार आता 5 वर्ष पण चालणार, तू 10 वर्ष पण पळणार, पण हा आतमध्ये काय मॅजिक नाहीये.
बरोबर बरोबर.
जसं वापर करणार तसं ते घसणार आहे.
बरोबर बरोबर.
हे तुला चालू असलं, मी तुला बोलतो 65-70 पर्यंत तुला ऑपरेशनचं नक्की आवश्यकता लागते.
बरोबर बरोबर, समजलं.
एक जे आहे एसेन्शियल, तुला आता एक हे वर खाली बोलायला सोपं पडतं. तुझे 60 हे फ्लोर्स जे चढतो 5 गुणा वजन ते गुडघ्यावर येतं.
हो हो.
सध्या तरी जमलं तर ते अवॉइड कर.
ओके, गुड.
एक तर आम्ही ठेवू, म्हणजे एक आम्ही काय करू, तू एक्सरसाइज केलं ते मसलला मजबूत करण्यासाठी कर, पण एक्स्ट्रा स्ट्रेन करून ते मजबूत करण्यात ते नुकसान जास्त आहे.
बरोबर, थँक्यू.
तर तू वेट ट्रेनिंग केलं तर ते समोरचं आणि पाठीचं मसलला मजबूत कर, तुझं पळायचं जे होतंय कर, पण तुझं हे अपडाऊन थोडंसं कमी कर रे संभाजी. गडबडचं काम आहे.
डाऊन करत नाही, फक्त अप होतो, अप करतो.
अपच त्रास देतोय तू, समजतो की म्हणजे ते घसणार पुढे.
गुड, समजलं.
मला पळायचंय, चढायचं, तुला आता ते डिफरंट टाइप्स ऑफ मॅरेथॉन करायचे प्रश्न आहे. सध्या तरी माझं तुला हे असणार की ते अवॉइड केलं तर तुझ्यासाठी ते गुडघ्याचं लाईफ वाढणार. जिथे आवश्यक नाही चढ उतार जास्त करू नकोस.
थँक्यू सर, थँक्यू.
ठीक आहे.
Great. Thank you, Sabhaji. We have Dipti here who wants to ask a question.
Yeah. Thank you. नमस्ते.
नमस्ते.
मैं दीप्ति हूँ. मुझे मेरा वेट 100 kg है. एज 57 कंप्लीट किया है. मुझे नी के लिए ऑपरेशन बताया गए हैं. नी बोलते हैं आपका नी अच्छा है, बट आपके हड्डियां बोन आपके वीक हो गए हैं. तो मेरा शेप भी, पैर का शेप टेढ़ा हो गया है. और मुझे स्टेयरकेस चढ़ने में मीन्स अगर थोड़ा सा भी कोई मीन्स चढ़ के अगर पार करना है तो उसके लिए भी मुझे सपोर्ट कहीं ना कहीं चाहिए मुझे, मीन्स कहीं भी पकड़ के मैं वो सपोर्ट से मैं ऊपर चढ़ सकती हूँ, या फिर मैं नीचे ऐसे हाथ रख के करती हूँ। तो मुझे क्या करना चाहिए? और मुझे थायराइड है, उसको भी 30 इयर्स हो गए थायराइड को गए।
तो दीप्ति, ये तो आपने बोला था ना, मीन्स ये हड्डी कमजोर होना वे अलग हो जाता है और हड्डी घसना अलग हो जाता है। अगर डॉक्टर ने आपको ऑपरेशन बोला है, मीन्स वो घसाई हुई है, मीन्स वो घस गया है।
अच्छा।
तो उसके लिए बोलते हैं ना, वो आर्थराइटिस, उसको ऑस्टियोआर्थराइटिस बोलते हैं, और जो अगर हड्डी कमजोर हुआ है तो उसको ऑस्टियोपोरोसिस बोलते हैं। तो मेरे हिसाब से आप जो पेन और जो सर्जरी का बोल रहे हैं वो घसाई के कारण आप कर रहे हैं। तो इसी लिए एक बार देखना तो जरूरी है कि आपको क्या जरूरत है और वो कैसे मैं हेल्प कर सकता हूँ, वो दिखा के मैं आपको आगे बता सकता हूँ।
ओके।
हाँ, वो
तो
जरूरी है,
आपका
पर समझ लो कि घसाई अगर हो रही है तो ऑपरेशन इज एन ऑप्शन, बट देख के फिर मैं आपको प्रॉपरली बता सकता हूँ कि आपको ऑपरेशन की जरूरत है कि नहीं।
ठीक है, ठीक है। तो आपके जो कॉन्टैक्ट नंबर हमें दिए हैं वहीं पे आप
हाँ,
लोग बता।
श्योर श्योर।
Yeah, thank you so much, sir.
Thank you, Dipti. Next question is by Shobna. I think you're there, so please ask your question. Shobna, she wants your number for an appointment, and she says, yeah, Shobna, please ask. I can see you have unmuted, so please go ahead and ask. Well, I'll ask on her behalf. She has cramps during speed running, and if she decreases the speed, then is it possible to get rid of the cramps? She's asking.
How old is Shobna again, and what has she done basically?
I don't know.
Yeah. So
But,
no, basically tell her to get her basic blood reports done. If she's above 40, then she's to get her bone density done. So, we'll address it from step by step, what needs to be addressed. So she needs to get her bone density done, get her
Right.
calcium, vitamin D3, B12 done. If these
Right.
parameters are good, then definitely reduction in that running will wait and watch and see whether that will help.
Great. And she says that she also gets toe pain in left foot after 3 or 4 kilometers, and same with shin pain.
No, this is all contributing to the deficiency state. Achha, she needs to get these reports done and see whether her body is fit for what she's doing or not.
Correct. So, Shobna, I think you heard us. She's 46 years old.
So she needs a DEXA and a calcium D3, B12 done.
So, Shobna, we'll share doctor's number just now in this chat box. And I think, Renuka, if you can just share it. And I think we have Parimal for the next question. Meanwhile, Shobna, do your blood test and the DEXA as recommended by doctor, and then you can visit him. Yeah.
Hi,
Parimal.
Doctor. Parimal here.
Tell me.
I am 38 years old, and I have been running this 10Ks on the road. I have never run on the soft bed, as you said initially. So last couple of years there was no issue, but last year in the month of July or something, I got some knee pain, and when I was walking also I was getting that kind of a pricking pain in that. So I stopped running for a month, but again now it's all normal. So I just have a fear that will it get back, or is there any concern that I need to relook at it?
Yeah, so Parimal, first thing, good you stopped. That was very important. Now you need to go to your strengthening again first. Don't look at running first. Look at, getting back to your lower body strengthening in terms of strengthening the muscles, and gradually start walking and seeing whether the pain is coming on or not. If even after the strengthening, the pain is on, means there is a problem. You'll need to get basic x-rays done to figure out if there is already some damage. So first, it's walking before we start.
Sorry to interrupt. Yeah, so I stopped running for a month, and again I resumed back. So again, now I don't have any problem now. I'm able to run again.
Very good. So, but don't do this. Don't do this. I would say, what type? Are you still strengthening or only running?
Both strengthening a bit in the weekends but running through the week.
No, both have to be in balance, Parimal. Otherwise, takleef hone wala hai. You decide now. You balance it out and you will not have a problem. I think you'll definitely run. But if there is an imbalance between how much you're running and how much you're strengthening, the pain will start.
Okay, got it. Thank you, doctor. Yeah.
Great. So we have somebody by the name of RO. Would you like to ask your question? Yes, please.
Yes. Yeah, so my name is Rohan. I just wanted to check. So, doctor, while I'm running, after some distance is covered, I start having this back pain, especially in the lower back. So, just wanted to know, is it due to lack of strength or is it like some incorrect posture or something?
How old are you?
I'm 38.
So it
And I
comes
started
down to
running only from last few months, basically
no,
now.
that's why it comes down to the same thing. Did you get your basic? Have you got your calcium, vitamin D,
Yes,
B12?
yes, I got them done.
So
And
that you
then
take your
only,
supplementation regularly, and it should be on the higher side. That is one
okay,
part.
okay.
Other than by reducing now, when do you say when does the pain come on in the back?
So let's say if I'm running 10 kilometers, after let's say 3-4 kilometers, 5 kilometers, I might start getting this pain in the back,
Right. So you
lower
need to
back.
start with back strengthening also on a different note now. So here it
Okay.
is going from the knee. The back is telling you that that little extent of when I'm running and the jhatka which I'm getting, I'm not able to take.
Understood.
One step
Understood,
back
sir.
to strengthening. So you learn, you start with if you're gymming or even doing your stretching, and this work more on the lower back. Work on the
Yeah.
back in terms of strengthening.
Okay.
See that
Understood.
thing goes off, otherwise you're going to cause damage to the back also.
Yeah, that's the reason I stopped it. I just wanted to figure it out.
Strengthening the lower back along with the knee also specific.
Okay. Okay. Thank you, sir.
She's off. Achal, you there?
Hello.
Yeah, Virendra. Vijendra, tell me.
Yeah, doctor, this is Vijendra here. I am 42 years old. And I have been running since last 3 years.
Right.
And initially when I started, then the target was 10 kilometers. Then slowly I graduate to 21 kilometers. And now I have been running 42 kilometers. That is full marathon.
Great.
So far, I have not faced any injury problem. Only the thing I want to ask that during the training plan, normally the coach who is giving the training plan, what they suggest is 80% of your running should be slow and easy, and 20% should only be the hard workout. And the logic they are giving is there are different kind of runs also. It is like training run, pace run, speed run, different kind of run. And the logic they are suggesting is when you run at a different pace, then the jerk which is observed on your knee, it is different, and that will help you to get away from, not get away, but that will delay your knee pain or something like that.
Right.
So is it what you also suggest, or
No,
how it
I'm
is?
telling you the other way around. As I said, to increase your stamina, I want you to incorporate cycling and swimming, Vijendra.
Okay.
See, stamina can be increased in different ways. You don't have to run for stamina.
Mm-hmm.
So to prevent more damage, you will be much more safer doing cycling or swimming, whatever you can incorporate in the middle instead of just running and increasing the
No,
strength.
yeah, actually, in the training plan also, one day they suggest like this only, that
Right.
you can do any different form of exercise which you
Yes.
told, like
Correct.
cycling or swimming
Right.
or strengthening. So what I am following is I am doing strengthening workout once a week, and running is almost four days or 5 days, and the distance and the intensity is also different for all the runs.
Right. No, so I would still say you look at one day of cycling also. It's not only about the thing, but so that you're ready for the main day, or you've got more stamina and more strength.
Okay.
So if you're practicing for the marathon, I would say you have to balance it out in terms of cycling, swimming, and running, everything.
Okay. And one of the one of the challenge I am facing, what you told in the initial session, that we should avoid running on the roads. But the place where I am staying, there is a very less options of running on.
That is the reason I'm asking you to cycle.
Okay.
You look at option of at least the cycling. Otherwise, Vijendra, you're going to be a nice candidate for surgery at a later date.
Yeah.
You take care of your knees, and the knees will take care of you.
Yeah, definitely.
Right. Very well said. And we have Kamlesh Gandhi who's asking, how do compression stockings help?
So compression stockings are altogether totally different in terms of the knee pain. That is basically to do with your blood circulation, and that will be very helpful if recommended by the doctor or somebody who knows that your problem is to do with varicose veins or something to do with the circulation.
Correct.
So it's effective if recommended by the right person, not just using it.
Right. And the sports compression stockings, basically, they help to enhance the blood circulation. So that's the different that we have here. We have a question by Ramesh Singh. Ramesh, if you're there, please unmute and ask your question.
Hello.
Yeah, Ramesh, follow.
Yeah, my question is with regards to long distance running. When we do long distance running, say marathon, after 25 or 30 kilometer, our knee starts hurting, and it feels it is like powerless. It lacks strength. Why is it so, sir?
Because those muscles have got fatigued now. The muscles are not strong for running beyond 25 kilometers.
Right, correct.
So Ramesh, you need to step down little, 2
Okay.
kilometers, 3 kilometers less, and increase your strengthening process. And I'm telling you, you'll definitely be able to run
Correct, sir.
205. So you just need to step back, increase the strengthening, and do the running. Otherwise, the brunt is going to come on the cartilage and there's going to be damage.
Okay, thank you, sir.
Get one step down, increase the strengthening, and then you can increase the running gradually.
Okay,
Right. Thank you so much.
done, sir.
Yeah. Thank you, doctor. Thank you so much, Rakesh.
Thank you.
I think we've covered all the questions from the people present today, but we do have some questions which people had written to us, and I'll just take one of them. Someone has asked, could Osgood-Schlatter occur due to running in adults? And if so, what is the treatment?
Right. So Osgood-Schlatter is basically in the growing age where there is a lot of strain coming on the patellar tendon. It is not Osgood-Schlatter if it is in an adult. If it is in an adult, it is because of strain. Same thing where tension is coming on that. So bottom line is that you're putting a lot of strain on the leg there, on the tendon attachment. There is now good. I have this in front of me. So Osgood-Schlatter is where this point of the bone, where the tendon of your patellar tendon is attached in a young person, in a growing bone, in that 14 to 16, where there is constant pushing here, stretching here because of the growth spurts, and there isn't adequate calcium, vitamin D. In an adult, this is not termed as Osgood-Schlatter. It is a strain. So the whole thing is finally the quadriceps mechanism only, which is being strained here because of increased running or without improper strengthening.
Right, right. So again, like you said earlier, get the blood test done, check for deficiencies, and meet the concerned orthopedic surgeon to get to know where the problem really lies and how to treat for further, so that you can save the knee for long-term running, basically. Right. I think Praful has come back and he wants to really ask his question.
That's fair enough. Let him.
Praful,
Hello,
yeah.
hello, good evening, both of you.
Yes, good evening.
Actually, I'm 64 years old. I'm doing daily exercise for last 30-40 years. At present day also I'm doing daily 100 sit-ups, 250 push-ups वगैरह वो तो करता हूँ. लेकिन what happened ना, actually as such I don't have any problem. I can run 10 kilometers around 55 minutes and 5 kilometers around 25 minutes. But people are just they are saying me that you don't stretch yourself. It will create a problem in future for your knee. Can you advise me on that this?
प्रफुल्ल, तू 100 पर्यंत जाणार आहे.
नाही तसं ओके, थँक्यू व्हेरी मच
तुला हे स्वतः निर्णय घ्यायचा आहे की तुला स्वतःचा गुडघा घेऊन घालायचं की मी ते बदली करून पाठवू तुला.
अच्छा, ओके. सो आय शुड नॉट
तुम्ही करणार रे. इतकं पडलं तर किती पडायचं रे. थोडं तरी बस.
हा ते
मी
ठीक आहे.
काय बोलत नाही. आय एम व्हेरी हॅपी फॉर यू. पण मी तुला काय बोलतोय, काही पण केलं वयाप्रमाणे जसं असतं, थोडं कमी केलं ते घसायचं, थोडं कमी म्हणजे पुढे जाऊन घसणार नाही ना. आतमध्ये काय मॅजिक नाहीये. आणि इश्यूज ॲज ओल्ड वेअर अँड टेअर वाढतं, रिजनरेशन कमी होतं. जे थोडंसं पण खराब झालं तर वाढणार, कमी नाही होणार. तर आम्हाला काय करायचं, आय वॉन्ट यू टू कंटिन्यू रनिंग, जम्पिंग टिल वॉट एव्हर एज यू आर देअर, बट यू हॅव टू रिड्यूस द इंटेन्सिटी ऑफ दॅट. आता तू डोक्यात घालायचं की मला स्वतः कमी करायचंय, की मला पुढे जाऊन ऑपरेशनची आवश्यकता लागायचंच नाही. आणि हे मी बोलतो ना, आता बोलत नाही. यू आर वन ऑफ दोज कॅन्डिडेट्स हू माइट कम इन फॉर सर्जरी अराउंड 80-85 प्रफुल्ल.
ओके ओके ओके
आता तुझ्यावर आहे थोडंसं कमी करून ते 100 पर्यंत घेऊन जायचं मला स्वतःच गुडघा.
ओके ओके.
थोडंसं कमी कर. बंद करायला सांगत नाही मी तुला, थोडं कमी करायला.
Sometimes the doctor, it is required for our mental also passion, running. Otherwise,
नाही आता मी म्हणून बोलतो, तू किती पळणार, मी बंद करायला सांगत नाही, मी तुला थोडं कमी करायला. दुसरं काय.
ओके 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 ओके, डेफिनेटली. थँक्यू व्हेरी मच डॉक्टर, थँक्यू व्हेरी मच.
Long-term preservation of your knees for many more years to come.
Okay, thank you.
Okay, doctor, we will take this. We'll do a hard stop with this last question from Karthik. Karthik, if you are there, we will unmute you and allow you to ask the question. We've already taken a lot of time from doctor, and this is absolutely the last question. So, Karthik, yes, please, I'll go ahead.
Yes. Hello, doctor. Like recently, I've been diagnosed with IT band syndrome. Like I overused that tendon. Like in July time, I ran 50 kilometers. After that, back to back, I went for cycling for 20 kilometers.
How old are
So
you?
doctor
How old are you?
advised me to take 4-week rest.
How old
But
are you,
still,
Karthik? How old are you?
I am 31, doctor.
All right, fine. Tell me now. Go on.
Doctor told me to take 4 weeks rest. But again, I'm getting the pain. Like I'm not able to run like before, and I
How
can't
is
claim
your
the stress
strengthening? Again,
also.
answering the same question. How has your strengthening protocol changed after you started, or you've just started running without strengthening?
No. I have not started yet running. Like
So what you do
I'm
is
doing.
you work out on the muscles, strengthen them first. Don't look at running, please. You've overdone it. There's like an overexhaustion, more like where you've got so much of strain, where there's going to be tendinitis and everything is going to be taking a little longer time to heal.
Okay.
So Karthik, start your exercise regime, which is the strengthening part.
Okay, doctor.
Do that for a month to 6 weeks. If the pain, and then gradually start with walking, gradual running. Don't go directly to the 20 kilometers.
Okay, doctor.
At any point, if that is causing pain, you need to meet up with a specialist who can decide your further line here, Karthik. Okay?
Okay, doctor. Thank you.
Right. Thank you so much, everybody, for joining this session. And thank you, Dr. Nair. I cannot thank you enough for all your valuable insights and tips, right from doing your blood tests and knowing your deficiencies, listening to your body, meeting the doctor, preserving the knee, and running safe for long term. Thank you so much, Dr. Nair. It was wonderful pleasure having you. And for all those who have asked for doctor's number, we have shared it in the chat box. Just click on the answered section tab and you will get it. Otherwise, you can visit kneecarecenter.com. Thank you so much, everyone. Thank you. And we will be there at TMM, stall number 56. In case you're coming there for your run, do visit our stall. Thank you. Yes, sir.
Bye. Take care, guys. Bye. Thank you.
Bye. Thank you.
Bye.
Bye.